forensic psychiatry, using virtual reality, as it says on the screen, in maximum security psychiatric hospitals. Very interesting and challenging population. And anything that can work is vital for us all to learn about. So come on up on the stage and tell us what you're doing with VR in a maximum security psychiatric hospital.
Thank you so much. Yeah, I'm really excited to be here, actually. And first of all, I want to say thanks to the organizers, Bring a Spiegel. I read your book, and I think that was my motivation to be here, because it's interpreted as a multiple person come here, share experience, and talk about VR. We are using VR for good, and I think it's amazing. It's amazing. They give me more energy to continue working with VR, because it's challenging also, you know? So thank you so much for all the people that are working with VR here. Yeah, my name is Fernando González. I'm working in a maximum security clinic in Växjö, Sweden. As 50% of the time, I work as psychologist. So I have patients. It's a really special group of patients. I can say that they have usually a complex problematic. For example, they have psychosis. They have also substance abuse issues. They have a problem with their families. They have problems with peers. And they have also a huge criminal history. So my patients, they have personality disorders, antisocial personality disorders with psychopathic traits, and also sadism. So it's a very, very small group in forensic psychiatry, okay? And in my 50%, other 50%, I work as a PhD student, and I working with VR, okay? So I want to say thanks to Marta Valenius. She's my supervisor, and she's the leader of this work in Sweden in forensic psychiatry. We are the first clinic in Sweden that they are using VR. So it's huge, and I'm really proud of that. Also, my assistant professor, Pia Hennebrink, Sean Per, and Christina Siegel, also a very important group. And also, I want to thank my family too, because I have 3 kids. I live in Sweden, and I've been here about 1 week, so my wife is doing an amazing job. So, okay, so let's continue. Yeah, this is the clinic. What do you think? Cold, dark, you know? Yeah, this is the maximum security clinic in Växjö. So you can see from November to March. I think this picture I took is a few weeks ago. We have snow, and this is the reality of our patients. So they are living inside in these walls, high walls. They have not so much possibilities to go outside. It's really restrictive. So we know that now at VR can give us a lot of possibilities to working with this population. We can bring other realities to a maximum security clinic. So we can give you an escape to my patients. It sounds really crazy to give an escape, but you know what I mean. With VR, we can do it. This I am in. We're using V-Relax also for relaxation, and they can be in a beach, for example, 5 minutes, 10 minutes, and yeah, they can feel this aha moment. It's a really wow moment to have VR. It's a really amazing. And I'm working right now with a group that we are trying to implement it, V-Relax in the whole clinic. So every single section can have easy access to this technology. It's a big challenge, but we are doing it. But the first treatment of the first VR that we are using was virtual reality aggression prevention training. This treatment came from the Netherlands, from our Professor Wim Welling. They are working there with aggression, and the focus of this treatment is to catch these persons. They have reactive aggression. Okay, they are impulsive, and this is a protocol-based treatment. 16 sessions, 40 minutes every single session. And what we're doing in this activity, if you want to know more about it, please take a look at this article. It's a perspective article because we want to share what are we doing, and we want to have more discussions. Okay? Yeah, this is the software. So in the VR computer, I can see in real time what my patient is seeing. And in this computer, I can tailor all the patient I can see. For example, I can put my patient in a bus, in a coffee shop, in a supermarket, in a prison, and yeah, we have a lot of environments, and I can change my voice, so I can be tough, something like this. I can act like a child, like a woman, or whatever. And I can do more specific this situation with the patient. So they use the VR headset, I use my microphone, and in wrap, they have four stage. The first one is the introduction. The patient is in VR, go around to see if they have severe sickness or not. Then the mapping, when we work with patients, we select these problems that they have with aggression problematic. We choose some scenarios that can help to training this situation, and then we go to phase number 3. That is working with the social skills training and CBT strategies, but it's more focused in the behavior than in the thought, because we need to be concrete with our patients. It's not too easy to abstract thinking, so that was the VR is so powerful with the population. Okay? And finally, it's evaluation with the patient. Okay? That's work wrap. But today also, I will share with you what we are doing with and the lessons that we learned during this project, because we started 2019, and we have a lot of challenge using VR, and in the middle is the patient. This is our focus, the patients, but we have ethical challenge. What happened when my patient don't understand what is happening in VR, and maybe they have a low EQ, for instance. What happened with the autonomy, or patients don't want to be in forensic psychiatry. They are placed in forensic psychiatry. So we have a lot of ethical challenge, and we need to be very careful when I'm working with VR. Also, another challenge is the therapists and providers with the technology. Yeah. How works the relationship with this. I think VR is not for everyone, not for every clinician, but I think it can be good if you can increase the knowledge in and how works VR. The clinic, the institution also is very important. We have the support of the management group, but it's important also work with the management group. So we have this support, and I know that others clinical are difficult with this, but something that is also very important to have a good relationship, dialogue, And finally, the financial resources. Yeah, I know that No, every single clinic can implement that VR. It's expensive, take time. You need people working with this all the time. When we are working in the clinic, I have a hotline. They can call me, Fernando, we have a problem with the software. It's not working. Can you come? I shake it. Yeah, I can come. And I look at it. So it's important to have this kind of relationship with people who are working and implemented virtual reality. Okay. So looks like the environment. This is the supermarket that I mentioned. This is a classroom. Yeah, you have a living room here, and you have an office. And here, for example, usually we work with a patient. Maybe we can say this is your doctor, and this is the nurse, and we give you more skills to have this conversation. But it's not easy when you have a conference with the team, and you need to talk about yourself in front of the psychiatrist. So all these things we can do in VR right now in forensic psychiatry. Also, we have others, professionals that they want to work with VR in the clinic, teachers, therapeutic occupationalists. We have also physiotherapists. Yeah, we want to, I'm sorry for this picture. We want to give more physical activity to the patient with easy games, for example, that they increase their motivation to the treatment. So it's not something we will also do. Pay attention to this picture. It's a really special picture because in the last version of Social World from Clever, now we can have cocaine in VR. So they give us another perspective. How can we work with addiction? So now we can train our patients in this kind of environment safely, and we can train, for example, say no to the drugs. You can do role playing in a hell other level, actually. So we are really, really happy. And finally, for my pitch, I want to read this expression. I think it's very important to keep this. It's a long way to the top if you want to rock and roll. I will read that again. I'm sorry, I read that again. It's a long way to the top if you want a VR. I think it's challenging, but it's really good. And we are working with VR for good, and I can see in my patients they are improving this well-being, actually. Thank you so much. This is my contact. If you want to contact me.
Thank you. That was amazing. Really interesting applications of VR. I've taken a lot of notes, taken a lot of pictures, having trouble keeping up with all the amazing material I'm hearing in this session. All right. Well, thank you for that.